evening, Borno, and welcome to another edition of the Borno Health Update. I am your host, Ibrahim Amarawa, here to shed light on the remarkable strides being made in our healthcare sector under Governor Zulum's visionary leadership. In this program, we focus on the transformative efforts spearheaded by Professor Baba Malimgana, Commissioner of Health and Human Services, who is driving innovation and resilience in our healthcare systems. A series of strategic initiatives by Borno State government are solidifying the future of healthcare in the state with a significant investments in medical education and public health program now bearing fruits. The Kashim Ibrahim University and Teacher Hospital have received resounding endorsement from the Medical and Dental Council of Nigeria MDCN, a high-level accreditation team led by the Registrar and Chief Executive Officer, Professor Fatima Abekari, recently concluded an inspection visit to my degree. The team, accompanied by the State Commissioner for Health, Professor Baba Malamgana, and the university's Vice Chancellor, Professor Babagana Guti, conducted an intensive tour of the medical college and teaching hospital facilities. Following the inspection, the MDCN team held detailed discussions with the hospital's management, offering expert advice for continuous improvement.
As you said, it's interesting that you saw you went to Leeds University. So I didn't know I also have my genetics here in this hospital because I was part of the design team for Leeds University and the project team. I actually gave them the brief for the university hospital. So I know that there's a lot of modification even following that one, but then it looks like there is something going on. We already talked about clinical departments, and I think it's very important to note that and ensure that they're all departments on their own, both academic and clinical. There has to be synergistic in all the departments. That was what I was talking about, the 18 departments. You could collapse it to 16, but normally when you expand all of them, there are about 18 departments in the whole of the medical college. So that is something that you like to consider, and I go with what everyone has said about super specialties and super skills. I think we need to think about super skills in all of those areas, because what you're offering is, number one, you have political will, number one, you have expertise, number three, you have the need in the population. So you just need to offer those services as a tertiary institution. So once again, thank you very much for taking us through. I don't think we need to go physically, except if you have a special place you want to show us. Okay. And then we'll just go back and have a discussion on the medical school and the next level of what needs to be done or how to modify what you already have. You've already done a lot. Some of the advices we go to, we don't even see half of this, or there is even nothing on the ground. They just need to ask. But what you are doing is you have done so far, and you're asking for modification.
I want to commend you and the state government for what you have done thus far. But like the Deputy Registrar rightly said, what we need is not just a good building with equipment, but a functional place where students can learn, where they can be trained, where they will see patients. And I think you started on the right path by having an MOU with your specialist hospital. So what you should do, while you are doing what you are doing here, let your second eye be working and a functional arrangement with them, so that by the time you are building your patient load here, they have a place where they can be going to compensate for the inadequacy in the number of patients you are having here until this place becomes full fully functional in the sense that you have adequate patients that students can learn from.
But more importantly, I'm just hopeful that the current fate of Bayes University Hospital will not befall this place. Because you see a very wonderfully built hospital that is completely empty. And nothing is happening there. And it's been over 5 years. It takes up to 10 years for any hospital of this nature to pick up fully. It is possible that with the kind of vibrancy that goes on in this state, especially where virtually everybody working in this state is a professor, from the governor right down to everybody. It is possible you might come up with ways, innovative ways, of attracting patients to this place, bearing in mind that this is on the outskirts of the city center. Because what makes a hospital for us is not just a building. It is about the functionality and what goes on there and the ability of the place to be used for the training of students. And so we do hope that bearing any unforeseen circumstances, that this place should be able to pick up soonest. And in the interim, we might have to be making an arrangement. This will not be the CMD now, it will be the university making an arrangement, because when we come next year, we want to see that there is a place our students can start postings in medicine and surgery. And while this project is ongoing and we're seeing it to completion and fruition, you might want to start looking at that direction. I'm sure you understand where I'm going with this. Seeing the quality of infrastructure you're deploying to this place, I can imagine that even the commissioner, at the inspiration of his tenure, might not want to go back to where he came from.
He's actually part of us. He has an office.
He has an office, right? So you must help him, let him deploy his knowledge.
Professor Baba Malam Gunai clarified the purpose of the visit, emphasizing that the government's ultimate goal is to elevate the hospital into a world-class medical institution. He stated that the MDCN team was highly impressed with the level of investment in both the medical college and the teaching hospital.
Appreciating the Medical and Dental Council of Nigeria, led by the registrar, the CEO of the council, in the person of Professor Fatima Abakari, who happens to be a daughter of the state and who happens to be the first female registrar of the Medical and Dental Council since it was established in 1963. She led 21-member team to Maiduguri to come and assess and accreditate healthcare institutions in the state. This included the University of Maiduguri Teaching Hospital. It included the Borno State Specialist Hospital, the Dental Hospital, and also the Kashim Ibrahim University Teaching Hospital, as well as the Al-Ansar University, which is also offering medical students and other allied courses. So it was a one-week tour for them to come here, and we're very pleased with the way and manner they worked in the state. You couldn't ask for anything better. They were calm, collected, and very respectable, and they were very happy that they have gone round the state specialist hospital, the nook and corners, and have assessed the situation and have increased the number of house officers that until now we have 12. That's been now increased. I'm very happy to say. So we can be able to serve the people of Borno State better in that context. The dental hospital is also has been in existence for a long time. Unfortunately, it doesn't exist as a training facility until now. With their coming, we are now able to start training house officers. And for postgraduate, we will now approach the relevant bodies to come and advise us on the way forward. So we are immensely grateful to the Medical and Dental Council of Nigeria for this. They have visited the Kashim Ibrahim University Teaching Hospital and Medical College, where they spent a lot of time in the medical college, quite rightly. They've gone through the various departments, the basic sciences department, and they have seen the laboratories and the teaching facilities, and they were quite happy that we have got what it takes to train medical students to become doctors eventually. So, they have given their note that, with small adjustments they have suggested, we can be able to carry on. And of course, the facilities are standard, and the facilities were not restricted in terms of numbers or classrooms. So the lecture theater can easily accommodate 250, 300 students at a time, and there are at least 2 of such lecture theaters. The library stood out as one unique center, which they think is one of the best in the country. The library, with the e-library by its side, was really very resourceful, and they commended it very highly.
In another development, the state has launched a crucial public health initiative, the Measles and Rubella Vaccination Campaign. The program was officially inaugurated by the First Lady of Borno State, Professor Falmata Babagana Umara Zulum. She made a passionate appeal to the parents and guardians to ensure their children are vaccinated, highlighting the campaign's crucial role in safeguarding the health of the state's youngest citizens.
It gives me great pleasure and honor to stand before you this morning at the official flag of the integrated Measles Rubella campaign, Phase 1, Stream 2, here in Borno State. Today marks an important step forward in our ongoing effort to protect the lives of children, to protect the lives of our children. The Measles Rubella campaign is one of the largest health interventions in Nigeria's history, targeting children aged 9 months to under 15 years. It aims to protect our children from measles and rubella, 2 highly contagious but preventable diseases that have taken far too many young lives. Measles can lead to blindness, brain damage, pneumonia, and even death, while rubella can cause serious birth defects, including blindness, deafness in unborn babies if a pregnant woman is infected. The good news is that these illnesses can be prevented through safe and effective vaccines. And that is the purpose of today's campaign. This campaign is called Integrated because it brings together several important health interventions: measles rubella vaccination, routine immunization, human papilloma virus vaccination to protect our young girls against cervical cancer, and polio vaccination to ensure these viruses are eliminated from our communities. Under the visionary leadership of His Excellency Professor Babagana Umara Zulum, the state government has remained fully committed to rebuilding the health system, improving maternal and child health, and ensuring that no community and no child is left behind. This campaign demonstrates this commitment. It is an opportunity to reach children in both urban areas, remote and hard-to-reach settlements, including those in IDP camps. To our mothers and caregivers, I speak to you as a mother myself. Please take your children to the nearest vaccination post. Vaccines are free, safe, and effective. They protect your children from these diseases and disability and give them a better chance at a healthy future. To our fathers, your support is vital. Encourage your wives and ensure all children in your family are vaccinated. To our traditional and religious leaders, I thank you sincerely for your unwavering support. Your voices carry great authority. Please continue to advocate for immunization and help dispel rumors and misinformation that discourage families from vaccinating their children. I also wish to acknowledge our development partners, the Federal Ministry of Health and Social Welfare, National Primary Healthcare Development Agency, UNICEF, World Health Organization, Gavi, and others for their consistent technical and financial support to the state. In conclusion, together we can protect our children from preventable diseases, strengthen our health system, and build a healthier and brighter future.
Commissioner for Health, Professor Baba Banamgana further elaborated on the life-saving importance of the vaccination drive. He reiterated Governor Zulum's unwavering commitment to the well-being of the people of Borno with a special focus on the health of women and children.
Excellency, it is indeed a great honor and privilege to stand before you today at what marks another historic milestone in the health sector of Borno State, the official flag-off of the integrated measles rubella vaccination campaign. This campaign is not merely about immunization. It is a bold step by how we deliver health services, bringing care closer to the people, and demonstrating once again that Borno is leading the way in public health innovation. At the heart of this achievement lies the vision, the empathy, the care, the transformative innovation, and unwavering commitment of His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, MNI, FNSE, whose leadership and prioritization of health have created an enabling environment for transformative impact across the state. No wonder the UN Secretary General, Antonio Guterres, declared our governor as the best governor in the world. The integrated measles and rubella campaign is nationwide health intervention aimed at interrupting transmission of measles and rubella viruses among children. In Borno State, this campaign is running for 10 days and reaching across all the 27 local government areas, reaching every child with aim of saving lives. This campaign adopts a multi-pronged approach, Your Excellency, by integrating additional life-saving interventions. Through this integrated approach, Your Excellency, we're ensuring efficiency, expanded coverage, and stronger community engagement, maximizing every opportunity to reach the unreached and improve the health well-being of our people. Your Excellency, our Executive Governor's innovative approach in maternal mortality reduction through bundle of bundles, such as the Suffer Birth Bundle of Care, which we have recently done a review so far, and I can tell Your Excellency, we have started saving lives. For example, in this very hospital, before SBBC, we're seeing at least 14 stillbirths per month. But with the introduction of SBBC, we are having 2 stillbirths per month, Your Excellency. 2 is too much, so our aim is to completely eliminate. Your Excellency, 97 newborns would have been declared dead previously before SBPC, but with the equipments we have used in resuscitation, we have been able to revive 97 newborns, and the mothers were happily taken their homes. So this program is working, and we appreciate Your Excellency when you give audience to the team from Norway when they visited you in the government house. We've also introduced the MAMI project, which is the maternal mortality innovative initiative by the federal government. We've also introduced the postpartum hemorrhage reduction. All these, including the investment in infrastructure, which included revitalization of 132 primary healthcare centers this year alone, the ongoing construction of 5 hospitals this year, the tertiary hospitals, Eye Hospital in Monguno, Eye Hospital in Biu, Dental Hospital in Monguno, Dental Hospital in Biu, the ongoing orthopedic hospital here in Maiduguri, the Kashim Ibrahim Teaching Hospital and Medical College, and the recently commissioned colleges of nursing and midwifery in Goza and Monguno are living testaments of health innovation in the state by His Excellency Professor Babagana Umar Zulum.
Earlier, the Executive Secretary of Borno State Primary Healthcare Development Board, Professor Arab Alaji, provided a powerful testament to the administration's support. He confirmed that Governor Zulum has consistently provided all necessary resources requested by the board, pointing out that the board will not relent in its effort to ensure the success of these healthcare initiatives.
This campaign represents a major step towards or step forward in our collective commitment to safeguarding the health and well-being of our children. The integrated MR campaign is designed not only to protect children from measles and rubella, but also strengthen our routine immunization, polio, and human papillomavirus vaccinations efforts, and therefore ensuring that every eligible child and adolescent receives essential life-saving vaccines. Under the distinguished leadership of His Excellency, Professor Babagana Umar Zulum, CON, MNI, FNSE, FNIAE, the Executive Governor of Borno State, and the compassionate advocacy of Her Excellency, Associate Professor Falmata Babgana Umara Zulum, we have made tremendous progress in reaching even the most difficult and underserved communities. Remember, the various vaccines that are going to be administered are free, safe, and effective. Immunization saves life and protects the future of our children and community.
Thank you for joining us. Stay tuned for the next week's update, where we will explore more innovations in the healthcare sector. This is Ibrahim Amarawa, reminding you health is wealth, and Borno is on the rise.